So when a patient comes through your door and has a particular complaint, how frequently do you find that UBI could be part of their treatment?
We probably treat anywhere from 10 to sometimes 15 patients a day with UBI, frequently in conjunction with other therapies that we're doing.
Wow. What makes a patient a good candidate for it? What type of condition?
I mean, the people that I select are those who probably have some type of immune dysregulation, maybe getting chronic infections, perhaps having chronic fatigue and fibromyalgia, perhaps having some types of skin rashes, and people that have failed so many other conventional treatments.
What led you to UBI as a treatment?
Well, I've been to integrative medicine meetings and functional medicine meetings for the last 30-something years, and I've seen the machine at these meetings, and finally I took the plunge. I was a little bit reluctant for many years, to be honest with you, partly because of the legal aspects and at least the connotation I had of the legal aspects of it, and I was a little bit reluctant, but finally I said, I've heard so many good testimonials about it from other practitioners at these meetings that I took the plunge and I added it into my therapies. And I'm glad I did. I mean, we're seeing very good synergistic effects with some of the intravenous treatments we're giving, with ozone treatments that we use, and many of the other nutritional therapies that we're using. We find it very safe. It's not uncomfortable for the patient. It's quick. They're in a big reclining chair. We draw blood on them anyhow half the time. And it's usually about 30 minutes at the most. And we just don't really see any side effects to it.
Do you see pretty quick results?
Yeah, I have, for example, one patient I can recall right now who's probably was about 45, 47 years old, who was having a lot of problems with mold toxicity, mold spore problems, a lot of fibromyalgia and chronic fatigue. And she had been someone who was in good shape, and she used to be like a jogger and would work out, but she just couldn't do it anymore because of her clinical condition. So I remember she came to my office and she must have asked me something about the biophotonic therapy, and I said, well, we do it here. And she was going to go to another practitioner 3 hours away because she didn't even know that I was doing it at the time. And I remember I gave her a treatment, and she came back about a week later and she said, guess what? And I said, what happened? She said she jogged 6 miles that afternoon and didn't even realize that she was doing it because she had been jogging maybe 1 to 2 miles prior to that. She was just trying to get her energy back and was jogging 1 or 2 miles. She said, I went 6 miles and I didn't even notice that I had been going so long. So she said her energy was just fantastic and she was just thrilled with it. And then she got the treatments probably like once or twice a week for the next 10 weeks or so, and she really overcame a lot of her problems.
Wow. Is it a bit of a job to educate people about this? You know, it's not something you hear about all that often. Many times patients hear about it via word of mouth. When you bring it up with a client or a patient, what's the reaction?
I think the best thing in my office that sells it are the other patients. And what I do is I simply bring the patients, I give them a little introduction about it. I then bring them into the IV room where we have the machine and chairs. And almost always there's somebody else on one of my machines. I have 2 machines. But there's usually somebody on the machine at that point. And I just ask the patient, hey, please tell this other new patient about your experience. And I let the other patients almost tell them and sell it.
If you had to pin it down, what's the best thing about using UBI?
I just think it's a great tool, an additional tool to add to our toolbox. We see so much chronic disease where people have failed every conventional and even many non-conventional treatments. And I think it's another tool to add into your armamentarium. We often combine it with ozone, with vitamin C, with other nutrient therapies that I do in the practice. And I think it's just a great tool to condition the cells to accept the other therapies more effectively.